Hello, everyone. This is Michael Laine here. I'm sitting in for Lisa Thomas, who had a conflict with her traveling schedule. We have a terrific show for you today and an amazing guest. Her name is Dr. Dawn Ewing. She is a biological dentist, and she has a quite amazing travel path here to where she has ended up with. Dr. Dawn is a naturopathic practitioner from Houston, Texas. She's executive director of the International Academy of Biological Dentistry and Medicine, an author of Let the Tooth Be Known, now in its fourth edition, and it was featured on the movie Root Cause, using EAV to test dental burdens. She began her career as a dental hygienist after graduating from the University of Texas Dental School in 1988 and was appointed to the Texas State Board of Dental Examiners by the governor, serving 2 terms. A thirst for knowledge about the human body immersed her in the world of emergency medicine. Becoming a nationally registered paramedic, she spent 12 years on a 911 ambulance and 4 years in international air ambulance transport. She began teaching CPR to the public, advanced cardiac life support to healthcare providers, and becoming an affiliate faculty member of the American Heart Association in 1987. She was drawn back into dentistry by a biological dentist. He was looking for someone with knowledge of the body as a whole, not just the mouth. This new excitement led her to return to school for a doctorate in naturopathy and a PhD in holistic nutrition and a doctorate in integrative medicine at Capital University of Integrative Medicine. Obviously a perpetual student, Dr. Dawn continues to do far more than the 80 hours of continuing education each year required for her combined licenses. Most recently, she was certified in functional nutrition by the Functional Nutrition Alliance. And that is a mouthful. Did I miss anything, Dr. Dawn?
No, other than I'm not a biological dentist. I am a doctor of integrative medicine, which is a PhD.
Okay.
I find burdens and help direct people to appropriate practitioners. So I don't want to be misleading in any way whatsoever. It's been a very interesting path for me as far as what I was taught in school. You have to understand that when I started off at University of Texas, we were telling people not to eat butter, to eat margarine, and stay away from eggs because they would make your cholesterol go up. And now we're in a totally different place. So sometimes medicine really does learn from its mistakes, and other times we're still in the Stone Ages.
There was something on your bio that really kind of struck me because I haven't heard of it before. And I know you're, on a 911 ambulance, for 12 years, but those 4 years of an international air ambulance transport, I know what air ambulance transport kind of is, but I've never heard the international tag on it. What exactly did that entail?
Yeah, oftentimes when you take a trip and you're going out of the country, let's say you're going to see the Great Wall of China, you're fearful that something might happen to you. So you take out an insurance policy that will cover you while traveling. And what would happen for my husband and I is we'd get a phone call and it would say, can you leave in 3 hours, be gone for 3 days, this is where you're going, take it or leave it. And so we always had a bag packed by the front door, and you'd have to know in an instant what you were doing in the next 3 days and say yes or no. I know my husband flew to Tokyo twice in 1 week to go get the same patient that when he got there, they weren't stable enough. And so he had to fly home and then fly back and get them. And you fly on commercial airlines. Sometimes they'll take out 6 or 9 seats in order to accommodate a stretcher patient. It's very exciting.
It sounds very exciting. And wow, you've, I bet, seen the world in a very unique way.
Good and bad, yes.
Yes, good and bad. I agree. Well, Dr. Dawn, we are going to talk a little bit. I know your book, Let the Tooth Be Known, that was on, featured on Root Cause, the documentary. So we're going to talk a little bit about your book today, and then we're going to dive into a multitude of topics that touch upon, some very critical and very important, subject matter. So what I'd like to ask you, looking at your background, you have such a fascinating career. in both the medical and dental fields. What inspired you to focus on the biological dentistry and write your book, Let the Tooth Be Known?
I was very conventionally trained in absolutely everything that I did in the very beginning. I gave birth to a son that was autistic about 30 years ago. And 30 years ago, there weren't very many people that could help me figure out what was wrong with him or what we could do to improve his quality of life. I don't have any fillings, but I had very high levels of mercury because of my exposure in dentistry and the fact that I had a quirk of a genetic flaw that wouldn't allow my body to detoxify correctly. It wasn't until I started putting puzzle pieces together and realized that I was so toxic that the reason I had 4 miscarriages was not only because of the MTHFR flaw, but I was so toxic that when the baby's blood would mix with mine, it was not conducive to life, so it would kick it out. And then my son helped clean up some of my body, but it was neurologically devastating to him. So that really took me out of the world of dentistry. I had spent many years on an ambulance. I understood that there is a time and place for emergency medicine, but I was also seeing things that were totally preventable. And I was frustrated, and I was actually talking to people that were having a heart attack on the way to the hospital about chelation, and whoever I was partnered with would go, "Oh my God, she's just absolutely crazy," or nutrition and how they could improve their quality of life. So I knew that I couldn't stay in emergency medicine and really had to get a better education in the arena, and naturopathy just seemed a perfect fit.
Well, that's amazing. That's an amazing trip there. Can you explain to our audience the difference between a traditional dentist and a biological dentist?
Certainly. A biological dentist understands that their scope of practice will not allow them to do certain things, so they'll need to network with a primary care MD or DO. For instance, if they were going to take out a tooth, they would want to know what the vitamin D level is and make sure that it's in a good window. They would want to make sure that the person doesn't have platelets that are so low that they would bleed to death. They would remove the tooth and strip out the periodontal ligament, which is not traditionally what is done. They would test you to make sure that you're going to be okay with the sutures that they're going to use. There's a lot that goes into biological dentistry. We think about just the way a mercury filling is removed. I mean, any dentist can take out a mercury filling, but the moment they touch that amalgam, that mercury filling with a diamond drill, it creates this invisible cloud of mercury vapor that we aren't taught is there. So the patient is breathing it in, the assistant is breathing it in, the dentist is breathing it in. And in a biological arena, we take very seriously our PPE. So we are in zoot suits to make sure that our exposure is non-existent. We take care of the patient, we protect the planet so we don't suck up mercury into the suction and then just dump it in the municipal water. Biological office goes through postgraduate training, and we actually certify dentists that are serious about becoming biological dentists. They go through 17 modules, and then they come before their peers and do a project.
Wow, that's quite intense. In a question here, and you brought with the amalgam fillings, we all know they got mercury in them. Is it true that even brushing your teeth activates them and
absolutely
leach out?
Yeah, I mean, we were taught in school that the mercury stays bound, but it's not true. Grinding your teeth, brushing your teeth, simply drinking anything hot or anything that's cold that's acidic. So you have a sip of Coke or you have a sip of cold coffee even. Mercury will come off of that filling, and depending on whether your body is capable of disposing of that or whether it will hoard it and build up over time like mine did, becomes an issue. I mean, my exposure started when I got my first vaccinations as a small child, but it wasn't devastating. And in second grade, I got contacts, but couldn't wear my contacts And my mom took me back to the eye doctor, and the eye doctor said, oh, I should have thought about it. Red hair, blue eyes, fair complected. I bet I have to use a contact solution for sensitive eyes. Because the old contact solution had thimerosal in it as a stabilizing agent to prevent bacterial growth. And putting that in my eyes made my eyes red and itchy, and I couldn't wear my contacts. I had all my vaccinations through college. I was using a contraceptive called the sponge, which you would get wet and insert vaginally, and it had mercury on there as the spermicide. So I had exposure to mercury without having amalgams in my mouth.
Wow.
Of course, I ate tuna, as most people do. So there are a lot of exposures besides just dental, but we don't realize how big of an issue any of the dentistry can be. It could be a crown that is a problem because you have a reaction to nickel, and the dentist didn't take that into consideration, and now you're having problems. So there's a lot of dental work that can create burdens. There's nothing as good as what God gave us originally.
No, I remember my mother telling me that for a long time. Yeah. That's been drilled in me. Yeah, literally. And, and I agree, the mercury effect, it's in our diet, everything. It has an accumulative effect,
Yes.
It seems honest. Yeah, it is. It makes you want, what and how to eat anymore, I've cut back myself on a lot of seafood, because of it. It's really, really kind of gotten out of hand. The meridian charts. Now, I'm aware of the meridian charts, and I know they're an important part of the human body. And I'm familiar with a little bit of, with the channels and everything. I do Reiki myself, so I'm familiar with, the energies of the body. But I know the meridian charts, the meridians, they branch out even more. Can you share some information on, what the chart is showing us and why it's so important?
Yes, each of the teeth actually are connected to different meridians. And that's not something that we were taught in school. That was my thesis work. I simply wanted to take x-rays on people, take health histories, and then try to plot out where things were. Well, goodness, it got to a point where I had a pile that was huge of men that had elevated PSAs where they had a root canal in one of the forefront teeth, top or bottom, or that tooth had been knocked out from some type of trauma and they had a cavitation. And so it created an awareness for me that there was more going on than what we were told in school. Now, chiropractors understand that there's a connection in the vertebra and the rest of the body. But, a traditional MD oftentimes will think that the chiropractor is a quack, and they dismiss that connection at all. But each of the teeth go through these meridians. For most of them, there are 8 teeth on a meridian, with the exception of your cuspids, which are traditionally called your eye teeth. And it's not just coincidental that those teeth are sitting on the meridian that has to do with the eye. Really, who knew that? Why did they call them eye teeth?
Yeah.
That wasn't anything I was taught in school.
Wow.
So there are 4 teeth on that meridian. There are 4 on the wisdom teeth that have to do with your heart and small intestine. But the others, there are 8 teeth on that electrical connection. So in dentistry, we are taught that we should save a tooth at all costs. We aren't even apprised of what those all costs are. We don't regurgitate that to a patient. We tell them that we can take out the nerve and the blood supply and the lymphatics, and that we're told to tell them we can sterilize your tooth. We'll fill it with a specialized filling, and it'll be fine. It'll be a dead tooth, but it'll be a healthy dead tooth. Now, where else in medicine can you have a healthy dead anything?
Exactly.
It's an oxymoron that doesn't exist. And we don't tell the physician, hey, I taxidermied a tooth. And if you start noticing in the blood work elevated neutrophils and that the lymphocytes are low and that you see a bacterial infection but you can't find it, send them back to me, because I also took out the nerve, so they won't have any awareness that there's an infection. But I may need to retreat that tooth. There's no communication between the two. So the doctor sees this chronic low-grade infection and finally just blows it off because it's been there for so long. Then the person starts to notice that their hemoglobin A1C goes up, because if they have any bent towards blood sugar issues, now all of a sudden they're being told they have diabetes, when they may not have diabetes at all. It may be very conditional on the fact that they have a chronic low-grade infection. If they clean that up, their hemoglobin A1C miraculously goes down without any drugs or any changes in diet, simply because it was conditional. Likened to a woman that has gestational diabetes because she is carrying that much weight and her pancreas can't deal with that. The moment she delivers the baby and loses the weight, they mark it off her chart that she's diabetic. It was only during the situation of her being pregnant.
Wow. That's really amazing. And, and where it's all taken. Have we ever proven the existence of meridians?
We do. Dr. Kim Bon Han, many years ago, duplicated another gentleman's work, and vice versa. Someone else then duplicated Kim Bon Han's work. And what he did was he injected a radioisotope into an acupuncture point and then started taking images. And what he found was it didn't go on an artery or a nerve. And that didn't make any sense. It was actually going up this energetic pathway, which as Americans, we think doesn't exist. We just don't acknowledge it at all.
Right.
Now, people that do energy work or in different countries that understand chakras and the meridians, they get it. But here, it didn't exist until Nixon had acupuncture done, and it worked for him, and then it became a posh, cool thing to do.
Right. Yep. Of course, yeah. So does the meridians kind of like thought of as circuitry?
Yes, that's the way I like to explain it to a patient, is if you're cooking in your home and you're using the oven and the stove and they work, you know that you have power coming to the home. But now you want to clean the dishes and you drop stuff in the garbage disposal and you put the dishes in the dishwasher, but neither the garbage disposal nor the dishwasher work. Well, if you're my husband, you're going to go out and see if the breaker tripped. But if the breaker didn't trip, then I'm going to insist he call a Lowe's or a Home Depot and get me a new dishwasher and a new garbage disposal and an electrician to put them in. When the electrician shows up, he asks if he can check the electrical circuit, and I tell him no. My husband's already done that. Just install the appliances. That's what I want. So he installs both the new appliances, but neither work. And so what he does then is what he wanted to do in the beginning, which is take an ohm meter and start going on the path of that electrical circuit. And what he finds is the first 3 wall outlets work, but the 4th one, the 5th one, everything beyond doesn't work. So now he's pinpointed precisely where he wants to cut a hole in the sheetrock to find the electrical disconnect, repair it, and my old appliances would have worked. But in dentistry, when we root canal a tooth, we are creating an electrical disconnect that is within the tooth. The only way to repair that is to remove the tooth and all the dead bone, and then the body instantly reconnects. See, I believe that God made our body so that it could heal itself. Right. When you cut your finger, the clotting cascade kicks in. You don't have to go look up in an encyclopedia what you need to be thinking about in order to get that to happen. It just happens. And you might be walking down the street chewing gum, talking on your cell phone, so you're multitasking all at the same time. When we have issues is when there's an electrical disconnect. So the way I try to explain that to a patient is, if I plugged a lamp in and it worked, we would know we have power coming to the building, a good cord, and a good light bulb. But if for whatever reason you decide to cut my cord and it falls on the floor, my lamp will turn off. If I call an electrician and say, this person just ruined my grandmother's lamp, can you fix it? Yes, I can splice the wire back together. But I don't understand what splicing is. Can you explain that to me? Certainly. I'm going to remove all of the dead air space and not make it closer, but they must touch. And when they do, you will see the light come back on. Now, while I'm waiting on the electrician to come fix my lamp, a dog walks in the room and poops on the wire. It smells horrible. The dog poop is not why the lamp won't light up. You're going to have bacteria in this tooth, but as a human being, you're exposed to bacteria every day. It's the electrical disconnect that creates the burden. In dentistry, the adage of saving a tooth at all costs is not fair. We need to look at that individual's immune system and see if that tooth is a burden. If it is, then we need to try to correct that by removing the dead tissue, which in this case would be the tooth and any dead tissue around it. As the body reconnects, then dentistry has the opinion right now that, well, we can just put an implant in there. Well, unfortunately, we've got two choices. One is titanium, which is known as a hapten, so it can trigger autoimmune. And it's likened to sticking a fork in an electric socket and then bending it around and sticking it in the bottom. It could short out the meridian. Porcelain is our other option, but electricity won't go through porcelain. So we're going to create a smaller burden. It's the difference between having a power pole fall down on 8 lanes of traffic and you can't go anywhere versus having one stalled car in a lane. You still have 7 lanes of traffic that you can use. So we like to really connect a physician and a dentist together because the dentist can't make the decision about whether it's going to affect the person's health. They need the physician to clear, no, this person doesn't have asthma or Crohn's disease or colon cancer. So this one particular area is okay. Go ahead and drop a porcelain implant in there. More dentistry just might not be the answer. We're such a cosmetic society here that our thought process is if I lost the tooth, I would have to replace it with a tooth. And yet I see people from different countries that don't have that same mindset and they are missing teeth and they're actually healthier than some of the people that we have here.
Well, this is really fascinating. It really is. Dr. Don, we got to take a quick commercial break and we're going to come back and I want to touch more on these meridians because it's very fascinating. We'll be right back.
We are the Global Health and Wellness Consortium and are creating one of the greatest stories that will ever be told. Our mission is to enable all living beings on Earth the highest possible level of health and vitality. We are just at the beginning, but are currently preparing to support each and every human being on this planet with life assurance for your health, assuring you can get the medical care you need. Life Essentials, to help provide you with clean water, essential everyday necessities, and a variety of home support for everyone. We even have Pet Assurance that will help you provide veterinary care for your furry friends in times of need. Join us on our journey to help transform the health of not only each of us, but the entire planet. Stay tuned. Our greatest life is on the horizon.
Okay, we are back here with Dr. Don. And to pick up where we left off on these meridians, so if a meridian is blocked, completely damaged?
No, that's a great question. I have an analogy that I often share with people. We had a flood here in Houston many years ago, and part of our freeways were completely underwater. So imagine that you would like to go on a road, but you can't get your car to the other side. If I had a magical vacuum cleaner and I could remove that water, the road would still be there, and you would be able to instantly use that road and get to the other side. The meridian can be blocked either from a dental issue, or it could be that the tooth is not getting enough energy because of an organ that is related to that. It works both ways, just like traffic goes both ways.
Okay. Yeah.
The blockage can interfere with either. But if you remove the blockage, your meridians are still there. It's very confusing to people when they're going, well, I don't understand how taking out a tooth is going to reconnect it. And really the only analogy that I can use is the lamp cord that people understand. But there are many things that can affect that tooth. We were taught that the only way a person gets decay is because they don't know how to brush and floss. So it becomes our duty-bound obligation to drill into them how to brush and floss.
Right.
And yet, there are many instances where you will have a son and a daughter, and the daughter comes in, sits in the chair, teeth are clean, but you find cavities. And then the son sits in the chair and you look at him and you go, oh my God, your teeth are green. Yeah, I lost my toothbrush 3 months ago. And he doesn't have any decay. It's very frustrating to the daughter who says, it's not fair. It's not fair. I'm the one that brushes and flosses all the time and I'm the one with cavities. But she will have some type of systemic problem. If you start looking at the pattern of where the decay is, you will usually see that the person is getting cavities all on the teeth that are on a similar meridian. If what I was told in school was true, that the only way you get decay is because the acids break down that enamel, there is thinner enamel on our front teeth than there is on our back teeth. We should have no front teeth before we get decay in the back.
Right.
It doesn't work that way. And I can look at x-rays and oftentimes tell someone what's going on with their health based on the pattern of decay. But what we want to do in the dental world is prevent decay. So if I've got a tool that I can use that says, okay, this is where you have an issue, I'm going to send you to a physician instead of a dentist, and we're going to get your bowels moving better, which in turn will make those teeth be able to get more energy and be able to thwart off the same acids that all the teeth are being subjected to. That is improved health. All we do now is take care of problems instead of being more proactive.
Wow, that's just that's fascinating. It makes so much sense, and it's like, why haven't we been doing this, from the get-go? It's it just. I got one thing to bring up to you though, because it affects me, and you brought up, genetic, like you said, you got the son and the daughter that came in, because I was born missing 2 teeth. My daughter, my youngest daughter, she's born missing 3. And she's just getting to the age to where, she's old enough where the growth implants, her growth plates are done growing to where they qualify her to get implants. So for people, when you're born with nothing there, what is the consequence? Does that have a consequence too, of breaking up in the meridians or losing something?
Yes, it certainly can. For instance, years ago, most people had their wisdom teeth. And through a dietary change introducing sugar, which has stunted jaw growth, many people now don't have wisdom teeth. They didn't have enough energy on the meridian to nurture the bud, and it died on the vine. And there can be a disconnect there where we would have to go in and address that by cleaning up a cavitation, or it might be that we could improve it by working on the other end of the meridian.
Oh, okay. All right. So in the case of the missing teeth, with hers, they're, it affects her smile.
Of course.
Yeah.
Yes. And so you do have options. We don't just have implants as options. We have Maryland bridges, where we can use biomimetic dentistry and remove the smallest amount of tooth structure in an effort to replace them. We do have options. There are
Okay.
times where people come in and their immune system is so compromised, they have so many health issues, and maybe they have cancer, that the burden of removing any electricity in their body is not an option, and we're going to go with a removable partial temporarily
Okay.
until they're healthy enough to withstand having something else done.
Okay. All right. That makes sense. Yeah, I can. That's real valuable there. Can you explain a bit more about the meridians and what teeth go to which organs and body parts?
Sure. Your wisdom teeth, like I said earlier, they're on the heart and small intestine. Those lower wisdom teeth are also on the energy exchange. So if you look at this chart, they're all orange. It's making it easier for you to see everything that is on a similar circuit.
Yes.
If you look at those front teeth, they're yellow, which the reason I picked the color yellow is because those teeth have to do with kidney and bladder and urine is usually yellow. So I just chose that. It made logical sense that it's kidney, bladder, ovary, uterus, prostate, all the genital urinary area is related to those. On the bottom, those front teeth have to do with the adrenals as well. Oftentimes, someone has a lingual bar that's been cemented in for orthodontic purposes that is affecting their adrenals. And then if you look adjacent to those yellow teeth, you'll see purple, and that simply is because I liked the combination of yellow and purple. I don't have anything to do with Louisiana, but I liked that. I thought it stood out. And then the thing that is really driving why I had to do this chart was because as I was trying to commit these to memory, I already knew the front teeth were all on the same meridian. And I was very aware that the wisdom teeth were on the same meridian. So it made logical sense to me that the top molars would be in line with the bottom molars, and they are not. They make a crisscross on the face. The meridian actually makes an X on the face. And me trying to commit this to memory was driving me crazy. So I finally got cards, just index cards, and I put everything on the floor, and all of a sudden I had this paradigm shift where I had an aha moment. I could have had a V8 where I said, oh my gosh, these top maxillary molars are not related to the lower molars. They're related to the bicuspids. And so that is why I did the chart, so that you could see the difference between where that blue circuit goes and where the green circuit goes. It's not the same as the orange and the purple and the yellow. It doesn't go in straight lines. And this chart, of all the charts that I had, and in order to make it, I probably had about 30 different charts, because chiropractors have one and massage therapists have one. And it's not traditionally taught in acupuncture, which I didn't understand. This is a German thing. You know,
Wow.
you have to look at the history of how this all happened. Marco Polo went over to Asia and brought back technology to Germans who ran with it. Dr. Voll, who was an MD, started putting the correlation of teeth together on certain meridians. And it's actually the Germans that came up with this concept, not the Asians. So go figure.
Yeah, go figure. Wow, that's really amazing. That's a nugget right there. I'll admit I'm surprised on that one. That one gets me. So I'm wondering. So if someone has a root canal, how does it affect the body? And the standard dentistry that we're used to, is it blocking our meridians?
It can be. It can be a burden. I stop short of saying that every root canal needs to be removed. It needs to be tested and evaluated. It is an electrical issue. I mean, it just makes sense. You just took something and killed it and left it in its place.
Right.
So from that standpoint, I liken it to somebody that's 105 years old and they are smoking 2 packs of cigarettes a day, and it hasn't killed them yet. But there's somebody else who's exposed to secondhand smoke and they have lung cancer, and they're in their early 20s. Everybody is different in what they can tolerate. And it may be that they can tolerate one, but they can't tolerate two. It may be that they can't tolerate one at all. It's very interesting to me when you start asking people health questions based on what you see is already manifested in their mouth. I'm looking at an x-ray and I see that they have 5 out of 8 teeth that are root canaled and they're all on the thyroid. I don't ask them any health questions before I start doing testing. But after I do the testing, I am able to start asking them questions. And how did you know that? Well, it didn't take a brain surgeon.
Wow. Right. Wow. Well, I'm going to tell you, Dr. Dawn, this has been a very enlightening conversation, very intriguing, and I would love to know more. And I want to ask you, you'd be willing to come back in the future so we can continue this conversation.
Most certainly. I really want people to ask more questions. I want them to seek out dentists that are enlightened. Just because you have a license doesn't mean you know everything.
Right.
It takes an awful lot of postgraduate education to really start to understand things. And both in medicine and in dentistry, we call it practicing because nobody knows what they're doing. We change our mind all the time.
Yes. Very true. That's a good, yeah, I'd have to agree with that. Well, Dr. Dawn, I want to thank you for being here and with us today. And thank you for sharing your wealth of knowledge with our audience. Look forward to having you back. And thank you, everyone, for joining us on Healthy Living.
Thank you for having me.